All right, so we are now recording po. So we sent the questions beforehand, so you may refer to that. You may refer to that as well. So let's begin with familiarity with AI applications in clinical settings. So for you, how would you define AI, and what comes to your mind when you think AI in occupational therapy?
Uh, for me, my definition probably when I first encountered the word AI, it's more on consolidation of everything that is available in the internet, and it somehow helps me as a person to have this concrete ideas or concrete outline if ever I have questions. So it gives a detailed and a cohesive information or facts.
Okay, so what do you think po are the applications of AI specifically in occupational therapy?
Um, so I think I listed down the practical applications first to be getting a general information on what is the topic about. Second, there could be probably a correlation of the intended topic or intended um, topic that you wanted to apply to your treatment. Third, maybe it's for asking for a better suggestion if ever you have an intended treatment plan, if ever is it okay with a given case, and that's it.
So for you po specifically, do you use generative AI applications in your clinical practice? And if yes, what has your experience been like? And if not, could you share some experiences behind not using them?
Okay. So personally, I only used it recently, actually just last year, because sometimes I get to encounter cases since I work in a hospital. There are cases that are kind of complex on my end, and somehow I don't honestly have the time to browse books or actual books for that matter. So I go to AI, generative AI, to ask for a summarized version, probably the points that's important to know regarding a specific case or diagnosis that would somehow help me, and save time as well instead of reading the books, to be honest.
So what specific generative AI technologies or applications do you use po specifically?
Okay. For now, I'm more into using ChatGPT.
Okay.
ChatGPT.
So would you say that um, using generative AI has impacted your role and your clinical practice as an OT, or in what ways has it not?
Actually, not really that much because I don't entirely rely on AI. Uh, Given that I use AI or ChatGPT, I only use it solely for the purpose of getting to know a specific definition or topic. But until then, the planning of treatment, the intervention strategies, I still I still try to base it from what I know and from the actual notes that I still have or references that I still have. Because sometimes it may be different, or sometimes to say I had this experience when I asked a specific definition that I want to know from ChatGPT, it gave me a different one that I was expecting from
So, would you say that you use it more of a search engine? And
search
in
engine as a search
yeah, and
engine.
then I guess in your usual week of working as an OT, how often would you say do you find yourself opening your generative AI applications like that?
It depends, pero it's not every day that I use ChatGPT. That's for sure. Probably I can say I only use it twice a week. Sometimes once or twice a week, but not that every day.
All right, so let's move on with the specific benefits of AI in clinical practice. So you were mentioning earlier how it can provide some consolidated information, and you use it as a way to easily search through your like different books or have questions. So can you expound on that? Like, what do you think are the potential benefits po of generative AI in the OT practice?
Probably the first one is it saves time. It really gives you, it saves time for you to look or read on actual books, especially if those books are not readily available. Because sometimes these books are very big or very, you know, hassle to carry. Second, it gives you another suggestion or probably another helpful suggestion on how to do things or on how to make a situation probably better. Or sometimes AI gives specific or a list of suggestions and we can check, ay, this one is helpful pala. Instead of using this one, I like this one.
So for you, what are your initial thoughts or like feelings about your current experiences with AI? How do you feel about using generative AI in your clinical practice?
Initially, I was kind of relieved because with all the work that I've been doing as a clinician, as a supervisor, and even as an admin officer, it somehow gives me relief that I can check AI whenever I need something. But I still try to prevent myself from looking at it always because as a teacher, I somehow would encourage my students, but then again, there should be a boundary whenever I would encourage them to use AI.
Okay, so for you, why do you think that there should be a boundary with using AI in the practice?
Because I believe that in AI, not to be biased, but sometimes the clinical reasoning is so best if it's human generated rather than a chat GPT or AI generated. And I think that's something that's very important to learn as a boundary. You can get the definition from AI, but then again, the consolidation or the clinical reasoning part must be on the human side.
Uh, Sorry, ma'am. Can you repeat that? I think it just lagged for a little bit.
I agree. So yeah, with what I said, I believe that the boundary, or rather, there should be still a boundary because the clinical reasoning sometimes is not there in AI. It can give you all the information, but as a therapist, if you're going to plan a treatment for your client and you use AI solely, the clinical reasoning part sometimes it's not that convincing or it's not that correct or um, really relating to the one that we intend to use for the patient. So for me, AI is good, but somehow it lacks the clinical reasoning part. That's still vital for us therapists.
All right. So based on that, do you think that generative AI will affect patient outcomes and the OT profession as a whole?
Thank you. Well, it can affect, but for me to say that it will be 100% effective or 100% that it would affect might be too early because I do believe that my use or experience in AI is not that as extensive compared to those who are using it for other purposes related to patient care. For me kasi, I only use AI when I plan interventions mostly. But I don't have yet exhausted the use of AI to be honest. So for me, it's only for the definition, what can be expounded further on a specific topic or diagnosis that I'd like to read about. Because I still have half of the time I still try to use my own stock knowledge or information that I've known or have learned in the past to still finish my treatment plans for the patient.
So, would you say that your hesitancy to use it more would be because of the importance of clinical reasoning for you?
Yes, for
Right.
me. But clinical reasoning is still different if it came from a human person, I guess, because AI doesn't really get to meet the actual patient or doesn't really get to experience, not unless you ask or you generated the question, right? So for me, it can be useful, but it's not that reliable in a way for me.
Okay, so in line with that, well, let's move on to ease of use and concerns with AI. So, you mentioned how it could not be so reliable and you really have to ask it specific questions. So, for you, based on your experiences, how do you perceive the collaboration between generative AI tools and OT clinicians, particularly in terms of how easy or difficult it is to use these tools in the practice?
Okay. But it's easy to use because you just input a question or you input a phrase, copy paste, you put it there, and it generates you the answers.
All right. So, um, would you say that like do you see any risks or challenges with the adoption of generative AI in the OT practice?
I okay, experienced one because yes, there are risks. Because number one, OT is not that new, especially the terminologies that we use, or probably the frames of references. You know, sometimes whenever I ask a specific frame of reference or a specific terminology, it generates a different one from what I expect. So it's not as common. Rather, that are not common for AI to really give you 100% answer. Sometimes I still have to clarify. Not that one, but more on something that's related to this topic or to this words. Mga ganun.
Okay, so parang it's inaccurate po on your
Yes.
alright.
Not 100% accurate, but sometimes, 80% accurate. I'm not that satisfied because I still know naman, but I just ask AI for further suggestions or further clarifications if any.
So, have you ever used AI po in terms of like really thinking of activity ideas or really just more of just searching with certain terms?
Not really for activity ideas because when it comes to activity ideas, to be honest, I search in Pinterest, but not really in AI,
Okay, so you find it po more helpful to look there rather than in
in
AI.
AI. Yes.
Okay,
Old
so,
school.
in your practice po, since you work in a hospital, do you find that other colleagues also use AI or do they not use AI?
I noticed that the younger colleagues use AI compared with us seniors, us senior OTs. We still really try to think on on the specific terms, but we use AI that much or every day, not really.
Um, so if age would be a factor, why do you think it affects po the use of AI?
Because number one, we are always on the gadgets. And I think post pandemic, everyone is already on the computers, right? Compared with us that we have experienced the pre pandemic part where computers are not that available. Sorry, not that available, meaning the laptops are not that utilized except if you're going to do papers. But yeah, for me, I think the pandemic kind of affected and the use of gadgets, frequency of gadgets among the younger ones are somehow contributing.
So would that be more of you think that the younger generations are more tech savvy or in a way parang they're just more like used to it, mas sanay lang sila to use these technologies more.
Actually, pwede both. Pwede both. They're tech savvy and, use these technologies more, the ones that are available.
All right. So, with the issue that you mentioned regarding its inaccuracies, how do you think these could be addressed?
Inaccuracies. Well, number one, there should be more available resources, probably uploaded in the web, like researches, or well, availability of resources. I guess. Although I'm not that familiar when it comes how AI generates information, but I think with the ones that are uploaded freely in the internet, they really do basic also there.
So, have you used generative AI for things like evidence-based practice?
Ah, well, to be honest, not yet. I still would like to go old school to read on search for specific articles or to really read it on my own rather than ask AI to summarize it for me or take out a few points because I don't know. I just wanted to do that way.
So, would you say it's more of you just prefer that process, or more of like you don't trust the generative AI?
Actually, I prefer that process, that OJS process, because number one, I'm not that adept when it comes to available AI for evidence based. You have the search engines, or rather AI that's specific for research purposes. I'm not that familiar when it comes to that. Pero just to share with you, recently one of my colleagues, a younger one, who's actually taking masters also in USD, shared with us a specific generative AI tool for researches or evidence-based practice that we can use, especially that we're also required to do research in the office also. But I'm not familiar. That's why I don't really use it that much.
So, do you know for the name of the generative AI tool?
Actually, I forgot, but I have the app, if I'm not
Okay.
mistaken. I'm sorry, it's on my other, yeah, it's on my other, I, sorry, I'm not sure if this is the AI app, but I have it here with me. Zotero, I'm not sure.
Zotero. Oh, okay.
Yeah, but it's actually the app that somewhere, if ever you just put it there, you input what the tool would use or would do, it would specifically lay out for you the topic, what's the um yeah, that what specific fields to be filled, and you just copy paste it as part of the topic approval for ganun. Yun lang. Yeah, I'm not familiar because yun nga, number one, I still I prefer personally not to use it pa.
All right. So, based on all of these, like, how do you think that let's move on to acceptance. So, how do you think these experiences influence your overall perspective on generative AI's potential impact in the OT practice? So, like, how do you feel about the future of Gen AI and OT?
Well, Gen AI in OT can be helpful only if it's being taught in a way that a student still or a professional should still have its personal touch or the clinical reasoning part. So not really entirely to base it because it's still different if you try to input something that you have personally saw or personally asked directly from the patient rather than just input every information in the generative AI, then AI would just put it everything in front of you. For me, probably as I have mentioned, boundaries still important, I guess, whenever you're using AI. But it can be good. It can be good. It's actually good because sabi ko nga, personally, it saves time. It saves time. But then I worry if as a student, you use it too much, probably to rely on it. And what if there come a time that the technology is not available or there's no signal, internet signal, diba? So who would you rely on if you're 100% basically on AI? Right?
So, with that, do you have any suggestions for preparing current OTs and I guess also upcoming OTs? for potential generative AI adoption, since you mentioned something with Reliant?
Okay, very good topic because it's a topic that we get to talk about, especially with us senior OTs. Number one, we, we would like to inform the students that it's welcome to be used. It's the times are changing, technology is there, very apparent. But then again, we would like to also provide a point wherein we all have to remind them that it's an actual person that they're going to deal with. Thus, their input is also important rather than just basing it purely from AI. There should be clear guidelines rather that one. Whenever, especially in internship, there should be clear guidelines as to what AI can be used or as to what as to what AI should have a boundary for.
How about for current OTs who are already working, aside from interns? Would you also suggest these things to them?
Yes, definitely. AI is good because I use it, but then again, do not 100% rely on AI. For me, just do not rely 100% on use of AI. Again, there should be a boundary on when it is going to be helpful and when it's going to be not helpful already.
So, for you specifically, would you like to be informed about generative AI-based applications, and would you continue to use it further in your practice? And can you explain why or why not?
Yes, I still would like to be informed because, of course, if there's an update on the newer tools or what, why not? You know? And then, siguro, I would just be the one to pick out which one is good for me or which one is not. So,
So would you say that you'd be open to using it beyond, um, I guess, as a search engine to also like inform your practice specifically?
ah, yes, yes, I'm still willing naman then to explore because before I give an answer to something, I would still want to be able to try it out. And if it doesn't work, then that's a time that I will be not using it, I guess.
So are there any specific AI technologies that you would like to be seen made for OT?
Ah, probably. Sorry, I remember it's a topic that we get to talk about. So aside from the guidelines to be created when it comes to AI use, which could be helpful also for clinicians and students alike. Probably AI when it comes to, sorry, we talked about this at work, so I'm still trying to recall. Probably on, okay, I remember. Probably on some kind of an activity bank. I don't know. I forgot already the term that me and my colleagues were talking about. Activity bank in the sense that it's classified according to probably age or probably the case or diagnosis. No, and then it still gives specific choices that you as an OT will just pick out and you will still be the one to consolidate or to still decide on it whether you're going to use that specific activity for a patient and so on. It's classified already whether it will be safe for this kind of patient or not.
So have you or your colleagues tried asking already the current AI technologies on like activities for certain ages or certain clients?
Uh, we haven't, but sometimes some of my colleagues ask for just age specific. But for you to go to in-depth specific, none of us yet tried it. Or if ever we tried it, yeah, it sometimes give us answers that we're not that satisfied.
So with the answers that you get from AI, and you said that it could really be a hit or miss. Would you say your overall experience with AI, would you describe it as more positive or negative?
positive naman. Positive. Not really negative, but it's positive for me.
Uh, in your personal, for like personal use, have you also tried using AI applications?
Yes, sometimes AI is my personal psych. I get to, I consult AI. I have this kind of concern, for personal use, but not really OT specific. AI sometimes becomes my life coach. For important, mga pinagdadaan.
I mean, that's a good idea naman po.
Diba?
So, how about naman with patients, since AI has been more increasingly used on the consumer level, have you encountered patients or like parents who have used AI to consult or like in any way related to
Not,
OT they use or wala naman?
not so
None.
far because most of them they use Google pa din.
Okay.
Not
But
AI
like,
para sa naging.
how about in terms of suggesting AI applications for your patients? Are you ever open to doing that, or how do you feel about that? So, for example, in certain practices, like in adult settings, there are applications that automatically like read the data that they get with like diseases or results, something like that. So, would you ever be open to
To be honest, I always face whenever I try to give something to my clients. Number one, their level of comprehension. Number two, their background when it comes to technology. Because to be honest, in my line of practice right now, most of the patients that I get to cater with are those uh, charity cases. So yeah, you get what I mean. Most of them are from low income families, and when it comes to the use even of their cell phones or applications, sometimes you still get to assist them because they're not familiar with this and with that. It
it?
still depends. That's why I haven't yet encountered a patient where I have to ask them to check this AI app or tool.
Correct. Yes, but it would really depend on the patient and the client. But I guess on a general perspective, how do you see the future naman po of healthcare as a whole evolving with the increasing presence of generative AI tools?
Well, generative AI tools could be helpful for the healthcare, most especially if not for the knowledge part or the content part of the paper or patient document, but rather it could ease the time or probably ease the life of the healthcare workers because one point AI can be used to record, no? Interviews, patient interviews. But us, OTs, whenever we do our IEs, right, instead of writing or typing it in the notebook, then we could type it back. Why not use AI? AI would record it and then it would type it out for you rather or summarize. For me, it has a good potential if it's used in a way that it doesn't interfere your clinical reasoning pa din.
All right, so I guess just as a last question, um, where do you see yourself if you were to explore AI more? Where do you see yourself using it next um, for your practice, or do you not see yourself exploring it more to support your practice?
Well, if it calls for, very open to any new information or technology that will be available as long as I still get to think. I still get to think and not really rely on it that much. If it would ease my time or ease my work or burden, why not? But then again, the part where I would be losing my personal touch when it comes to treating my patient or planning a treatment plan for them, that's a part I would like to avoid, given that AI would be improved in the future or more tools will be available.
Okay, so for a follow-up on that, 'cause with the scarcity of OTs here in the Philippines, I think one of the things that we're looking into is that if AI would, since again you said it could be useful to like save time, do you think that it would help with the lack of like OT would help with the lack of sorry, AI would help the lack of OTs here in the country?
To be honest, no. Not, no. No, an actual OT cannot replace a cannot. I'm sorry. Rather, let me refrain. AI cannot replace the fact of OTs lacking in the country. You know, AI is helpful at a certain point, but not really to the point that it will replace or fill in the gap of the lack of OTs or the decreasing number of OTs in the Philippines or the country.
So just to I guess wrap up everything that you said, if my understanding is correct, it would be you're open to AI, but it's more of you find value in the personal touch and as well as clinical reasoning to truly ensure that you provide the best care for your patient.
Yes.
All right. All right. So I think that's it naman po for our interview. Uh, thank you again for making the time. Apologies if you're still out for if it was a hassle to join our interview for today, but we really got some good insight and we thank you for making the time. And we'll send the transcription of your interview soon, so you can check na lang po if your answers are consistent with what we noted down. So, do you have any questions or anything you want to say po before we end
Well,
the meeting?
not so far on my end, but I want to say good luck and thank you also for having me. Please say hi to Dr. Ivan
Okay.
on
Will
your
do.
behalf. And this is a good topic actually because, to be honest, a lot of OTs that I know are relying so much on AI. It's a good thing, but then again, the boundary is still not that clearly defined. And maybe you can find it also in research to to put that, the good and the bad side of AI as well in the OT practice.
Um,
That would,
just to share po, in UST, kasi we have, I guess, for students, we have like a guideline on where you could use
very
it.
good.
Uh,
Nice.
is there something like that present as well in UP or in PGH po?
In fact, not that clear cut because we're still formulating the guidelines also in the clinic, especially for interns. No? But it's nice to know that in the schools, you have that already. It's the first time actually that I've heard of it. I haven't heard it yet from UP as well. I'm from UST, but I'm happy. I'm happy that you have that. Yeah.
Yeah, I mean,
Because
it's
we want
kinadoc
to
I
try.
yan.
Ay, sila, okay, yeah, Sir Ivan, yeah. Okay, pero we want for the next school year, especially in the internship manual, we would like to put, certain guidelines when it comes to AI use because just to share, sometimes interns will submit a paper that's purely generated from AI. And if you have seen the patient, the actual patient, it won't fit. Sabi ko, saan niyo ito pinulot? But it's good. It's nicely written. Everything's written nicely. Activities. But if you're going to apply it to the patient, kaya, ha? Kaya niya ba yan? Ganun. Yun.
I
Diba?
see po, yeah. So it's really more for you'd say the more on the training side po, but in
Yes.
practice, wala naman po masyadong
Wala naman.
concerns.
Wala. Wala naman. Concern.
But would you say in PGH naman po, open naman po sila with
Yeah, open.
using.
We're open already. And it's not that
And of
strict.
course, for you specifically po, if you're open to it. So, yeah.
Yeah, open
I think,
naman.
so, yun lang naman po for our interview. So, do you have anything else to ask or if you want to share pa po?
None naman. None
Okay.
naman.
Great.
Thank you
So,
so
thank you
much.
again for making the time po na And we really appreciate your insights. And again, we'll just reach out again to send
Yeah.
you the results of our study and the transcription as well. So
Thank you
thank you
so
very much.
much.
You may now leave the meeting. Thank you so much.
Thank you. Thank you.